Are you paying attention to the subtle signals your body sends each day? Sometimes these small signs are powerful reminders of our health. Welcome to Healthy Aging Tips, where we care for ourselves from the inside out, striving for a life that's healthy, long, and fulfilling. In today's video, we'll uncover 7 common signs of high cholesterol that often go unnoticed. Ignoring these signals could cost you your heart health, brain function, and even your life. If you care about preventing illness, maintaining your health, and living a peaceful life, don't forget to like this video to help spread well information. Share it with your loved ones and friends, because health is life's greatest gift. Subscribe to Healthy Aging Tips and tap the bell so you never miss our weekly health insights. Let's take a moment to slow down, tune into our bodies, and nurture our health every day, so aging becomes a journey of joy and vitality. Now let's dive into the 7 signs of high cholesterol. High cholesterol is often referred to as a silent condition because it typically does not present any clear or obvious symptoms. This is one of the reasons why it is so dangerous. It can develop over time without being noticed, and people may not realize they are at risk for serious health problems until significant damage has already been done. As a result, many of the so-called signs people associate with high cholesterol are often misunderstandings or assumptions. For example, symptoms such as chest pain, fatigue, or headaches are commonly linked to high cholesterol. However, these symptoms can also be related to a wide variety of other conditions, such as stress, poor sleep, or other heart diseases, and are not necessarily caused by cholesterol issues. In fact, these signs do not directly point to high cholesterol itself, but may be the result of complications from plaque buildup in the arteries, which can lead to heart disease, stroke, or other cardiovascular problems. Additionally, many people mistakenly believe that if they don't experience any symptoms, their cholesterol must be normal. This is problematic because, as mentioned earlier, cholesterol can silently damage blood vessels without causing immediate pain or discomfort. Without regular monitoring of cholesterol levels, individuals may remain unaware of the risks they face, and by the time symptoms appear, the damage may already be significant. Since high cholesterol typically does not show clear symptoms, the only way to know if you have high cholesterol is through a blood test. Health experts recommend regular cholesterol screening, especially for individuals over the age of 40 or those with a family history of heart disease or other risk factors. Early detection and lifestyle changes, such as improved diet and exercise, can help manage cholesterol levels and prevent long-term health complications. Xanthomas are fatty lumps that form under the skin, and they often appear in specific areas such as the elbows, heels, knees, or eyelids. When located on the eyelids, they are called xanthelasma. These lumps are generally soft and yellowish in color, and they are usually harmless, being benign growths. However, their presence can be a sign of an underlying health issue, specifically related to cholesterol and fat metabolism. Xanthomas are commonly associated with high cholesterol levels in the blood. When cholesterol accumulates in the bloodstream and the body struggles to process and break down fats properly, the excess fat can get deposited in different areas of the skin, leading to the formation of these lumps. This is often the result of a condition known as dyslipidemia, which refers to an imbalance in the levels of lipids, fats, in the blood. Xanthomas may be one of the visible indicators of this condition, signaling that there is a metabolic imbalance occurring within the body. Although xanthomas themselves are usually harmless, they can serve as an early warning sign that cholesterol levels may be too high, which can increase the risk of developing more serious cardiovascular issues, such as heart disease or stroke. It's important to note that xanthomas are not caused by high cholesterol alone. They often appear in people who have a combination of high cholesterol and impaired fat metabolism. This means that even individuals with normal cholesterol levels but poor fat processing can develop these growths. If you notice the appearance of xanthomas on your skin, it's a good idea to consult a healthcare professional. They can help determine whether high cholesterol or another metabolic issue may be at play and advise on necessary steps to correct the underlying problem. Many people mistakenly confuse serious complications such as heart attacks, high blood pressure, diabetes, or strokes with symptoms of high cholesterol. In reality, these are not direct signs of high cholesterol, but rather long-term consequences that can occur when cholesterol levels remain elevated over time. High cholesterol itself does not cause pain, fatigue, or any noticeable physical symptoms in the early stages. Instead, it silently damages the inner walls of blood vessels, leading to the buildup of plaque inside the arteries. This condition, known as atherosclerosis, gradually narrows and hardens the arteries, eventually resulting in complications like cardiovascular disease, hypertension, or stroke. For example, someone might suffer a heart attack due to a blocked coronary artery, which was caused by years of cholesterol accumulation. However, the heart attack is not a symptom of high cholesterol. It is a dangerous outcome that develops after prolonged exposure to risk. This misunderstanding often leads people to ignore their cholesterol levels until it's too late and serious health issues have already developed. It is important to distinguish between symptoms and consequences. Since high cholesterol usually has no early warning signs, the only reliable way to detect it is through a blood test. Regular screening is especially important for individuals over the age of 40 or those with a family history of heart disease. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and stress management, can help prevent high cholesterol and reduce the risk of life-threatening complications. Early awareness and action are key to protecting your heart and overall health. There is a major confusion in public understanding between high blood cholesterol and cholesterol plaque, but it's important to know that these two terms refer to very different things and should not be treated as the same. High blood cholesterol refers to elevated level of cholesterol circulating in your bloodstream. Cholesterol itself is a fatty substance that is essential for building cells and producing certain hormones. However, when levels get too high, especially LDL, low-density lipoprotein cholesterol, often called bad cholesterol, it may increase the risk of problems over time. On the other hand, cholesterol plaque is the result of cholesterol being deposited into the walls of arteries, along with other substances such as calcium, cellular waste, and inflammatory cells. Over time, this buildup hardens and forms plaque, which can narrow or block the arteries, a condition known as atherosclerosis. This is what directly contributes to heart attacks, strokes, and other cardiovascular diseases. Here's the key difference. Not everyone with high blood cholesterol develops dangerous plaque, and some people with normal cholesterol levels still develop plaque due to other factors like inflammation, oxidative stress, or poor metabolic health. That means cholesterol in the blood is only one piece of a much more complex puzzle. Unfortunately, this confusion often leads to fear-based messaging, making people believe that any elevation in cholesterol is automatically dangerous. As a result, many rely heavily on medications without addressing underlying lifestyle factors, such as poor diet, lack of exercise, and chronic stress. Understanding the difference between cholesterol in the blood and cholesterol in the arteries is essential for making informed decisions about health. Treatment should focus on the root causes, not just the numbers. In today's world, society has developed an unjustified and often exaggerated fear of cholesterol. For decades, cholesterol has been portrayed as the primary enemy of heart health. As a result, many people automatically assume that having high cholesterol is dangerous and must be treated immediately, usually with medications. This widespread fear has led to the overprescription and overuse of cholesterol-lowering drugs, particularly statins. While medications can be helpful in certain high-risk cases, relying solely on them without addressing the root causes is a short-sighted and often ineffective approach. High cholesterol is not simply the result of eating fatty foods. It is often a symptom of deeper metabolic imbalances, such as chronic inflammation, insulin resistance, poor diet quality, sedentary lifestyle, and stress. Unfortunately, these contributing factors are often ignored in favor of a quick pharmaceutical solution. By focusing only on cholesterol numbers, we miss the bigger picture. Many people with normal cholesterol levels still suffer from heart attacks and strokes, while others with high cholesterol remain healthy. This suggests that cholesterol alone is not the sole culprit, and treating it as such oversimplifies a complex issue. Moreover, the long-term use of medications without lifestyle changes can lead to new health problems, including muscle pain, liver issues, and nutrient deficiencies. More importantly, it gives a false sense of security. People believe they are protected just because they take a pill. To truly improve heart health, we need to shift the focus from fear to understanding. This means embracing a more holistic approach, improving diet, increasing physical activity, managing stress, and treating the whole person, not just a lab result. Cholesterol is not the enemy. It's a part of the body's natural system. It's time we stop fearing it blindly and start addressing what really matters. In modern healthcare, prescription drugs are often used to treat symptoms rather than addressing the underlying causes of illness. While medications can provide quick relief or help manage certain conditions, they do not always solve the root problem. This is especially true when it comes to metabolic disorders such as high blood pressure, type 2 diabetes, and high cholesterol. When we focus solely on controlling symptoms like lowering blood sugar or cholesterol with medication, we may be ignoring the real issues such as poor diet, lack of exercise, chronic stress, or inflammation. These lifestyle-related factors are often at the core of metabolic dysfunction. By suppressing symptoms without correcting the cause, we allow the imbalance to persist and worsen over time. For example, a person might take cholesterol-lowering drugs for years without improving their eating habits or physical activity. On the surface, their cholesterol numbers look better, but their body may still be inflamed and metabolically unhealthy. This can eventually lead to more serious conditions like heart disease, stroke, or even cancer, as the underlying inflammation and cellular stress continue unchecked. In some cases, long-term drug use can even introduce new health problems, such as side effects, liver strain, or hormone disruption. While medications have their place, they should not replace lifestyle changes. True healing often requires a more holistic approach, one that considers the body as a whole rather than just isolated symptoms. To prevent disease and promote lasting wellness, we must look beyond quick fixes and aim to understand what the body is trying to tell us. Only by treating the root cause through proper nutrition, movement, rest, and stress management can we truly reverse or prevent chronic health issues. Arcus senilis is a condition characterized by a white or yellowish ring that appears around the outer edge of the iris, the colored part of the eye. It is commonly seen in older adults, which has led many people to believe that it is simply a normal part of aging. However, this assumption may overlook a deeper issue. Arcus senilis can actually be a visible sign of impaired fat metabolism, especially when it appears in people under the age of 60. This ring is caused by lipid fat deposits in the cornea, and its presence may indicate elevated levels of cholesterol or triglycerides in the blood. While the condition itself does not affect vision or cause discomfort, it can serve as an external marker of internal metabolic imbalance. In younger individuals, the appearance of Arcus senilis should be taken seriously and may warrant further investigation into cholesterol levels and overall cardiovascular health. It's important to note that not everyone with Arcus senilis has high cholesterol, and not everyone with high cholesterol will develop this ring. However, its presence, particularly at a younger age, should prompt a closer look at lifestyle factors, including diet, physical activity, and liver function, all of which play a role in how the body processes fats. Mislabeling Arcus senilis as a harmless sign of aging can lead to missed opportunities for early intervention. By recognizing it as a potential warning sign, especially when paired with other risk factors, individuals can take steps to improve their metabolic health through proper nutrition, exercise, and medical monitoring. Understanding what the body is trying to signal can help prevent more serious health conditions down the line. Thank you for joining us today. We hope these tips help you take a step closer to a healthier, longer, and happier life. If you found this video helpful, don't forget to like it and share with your friends and family. Subscribe to Healthy Aging Tips and turn on the notification bell so you never miss out on our weekly health tips. Remember, health is the true wealth, and small changes today can lead to a brighter, healthier tomorrow. Take care of yourself, and we'll see you in the next video.